Betsy is a licensed occupational therapist who specializes in therapeutic yoga and relaxation. You also saw her contact information on the board just a moment ago when Michelle was presenting that. She has an integrative medicine practice and teaches at the Cancer Support Community in Walnut Creek and also in Forma in Orinda.
It's no denying I'm very short. So I'm actually going to move around a little bit today because I'm also a yoga teacher, and I recognize some of the people that are come to my yoga classes in the audience, so thank you. First of all, I start my day, and I just want to start by saying I light a candle. I have 3 daughters, and we light a candle to start the day, to start our energy. And I just want to let you know that right now I feel that there is very good energy in this room. So we spend a lot of time in my life talking about what energy is. So just prepare you. You're going to probably take on some things you've never thought about before today. We are actually going to leave Walnut Creek, California right now. And we're actually going to take a plane trip. It's time for a vacation. Don't you feel like you need a vacation? What I'd like for you to do is actually I know you're holding papers, and if you could put your papers underneath your chair, and also go on and get out. I'm the one that was the impetus for the pink tennis ball in your bag. So if you could get your tennis ball out and just put it on your lap. So if you could just rest your tennis ball on your lap. We're not going to really use it right this second, but I want to just go on and start with that, getting it ready. So we're going to take a plane trip, and we're going to escape to a tropical island paradise. Okay? We're going to leave the West. We're going to leave Western medicine, actually, for just a little bit, and we're going to travel east. Now, what I speak a lot about this, and what in an ideal world, you would have an eye pillow on your eyes. You'd be laying down when we would go through this. But we don't have that opportunity. But what I would like for you to do is, if you have glasses on, if you feel comfortable removing them. And I'd like for you to close your eyes. Take a deep breath in at the back of your throat as you release your tongue from your mouth and drop your jaw. Take a deep breath in between your eyes and exhale or release that breath at the base of your neck. Take a deep breath into your breastbone and exhale as you release your shoulders from your ears. Inhale into your breastbone once again and exhale as if there were a light wind coming across your shoulders, exhaling that wind over your shoulders, your elbows, your wrists, and your fingers. Take another deep breath into your heart center and melt your heart. Inhaling for a count of 4 into your heart center, but exhale for a count of 8 as you send that breath to a part of your body that needs healing today. Wrapping your breath around that body part, finding comfort from your own healing from your hurt. Take another deep breath into your heart center and exhale as you send it all the way through your spine, through your hips, your knees, your ankles, and your toes. Inhaling once again into your rib cage as you fill your rib cage with air like a balloon. And exhale as you weave your breath through each and every rib, through your hips, your knees, your ankles, and your toes. So you find yourself being escorted off the plane. What would have been 18 hours was just 3 minutes. And you arrive in a tropical paradise where there is sun shining, it's a light breeze, and you're literally escorted to a waterfall. The birds are chirping, and as you take a deep breath in, the water is not cold from the waterfall. It is warm, it is temperate, and it is wonderful. Take a deep breath in, and the water slowly flows over your toes. And as you exhale, the water recedes. So following your breath as the water comes onto your toes, and exhale as it recedes, just enjoy paradise. Slowly starting to wiggle your fingers and your toes, and slowly opening your eyes. So I hope that your rainbow is like this one, and your waterfall was wonderful. My classes at the Wellness Center, and for the most part for healing and integrative medicine, all start with relaxation and they end with relaxation. And they're very similar to that. That's called a body scan. So what is yoga? Yoga refers to a traditional, it's physical, mental, and discipline, and it originated in India. It's been practiced for thousands of years, and it literally means the union of the body, the mind, and the spirit. Yoga is an ancient philosophy of healing, and it's a practice that combines, which is maybe a surprise to many of you, breathing, physical postures, and meditation. And it's been practiced for more than 5,000 years. The other thing that may be a surprise to you is that there are 8 limbs of yoga, and they are these. It's actually founded with a Sanskrit language, so these words seem a little different to you. The yamas are a list of what our personal values and attitudes are that we cultivate, which goes a little bit back to what Dr. Svan talked about what your lifestyle is like and who you are. The niyamas are a list of healthy and productive habits to develop, and we learned that today as well. The asanas are yoga exercises for the body, and that's probably what you're most used to hearing about. Now, pranayama is what we just did, and those are breathing exercises, but they can energize our body or they can calm our body. We'll talk about that in a minute. Pratyahara is also the practice of calming and stilling our senses, and that's what we just did. The dharana is focusing techniques to increase concentration, and I'll talk about that in a minute. Dhyana is meditation, and the samadhi, however you see spiritual to you, is what it is. So yoga can rescue each of us. And I love this quote: we're never too old, never too sick, never too late to do yoga and start from scratch once again. And if all you get out of today that yoga is breathing, you're right. My grandmother passed away at 103, and she's at 92 started teaching aerobics. So we're never too old to start something new. So interestingly enough, I spend a lot of time talking about how a different way to think about medicine. And in particular, how yoga affects the nervous system and what you just did with the breathing. So Kripalu is a place in Massachusetts, and the gentleman who started that's called Richard Falls. And he states, yoga relaxes you, and by relaxing, you heal. For many of us, we have fast-paced lives, and the technology right now, not only is it fast-paced, but it has a lot of energy. Energy that you have no idea, we have no idea how it's affecting our bodies. So the thought is that the autonomic nervous system is divided into two parts. The sympathetic nervous system, which is a fight or flight response, and the relaxation, the parasympathetic, which is our relaxation response. I lecture at Duke, I used to work at Duke Medical Center in North Carolina, and actually went back to lecture to their therapists. And I said, I want you to feel that this hospital is a major city. And do you know what your heart rate is when you go and you take your patient's pulse? How many people have you seen, and how fast are you running in? Now, one of the things that I would encourage you to do with your caregiver, whoever it is to actually say, can we take a deep breath together? Because we all need to be reminded, whether they are the caregiver or they are you and us. Herbert Benson does amazing work. He's a Harvard professor, and he's director of mind-body medicine at Mass General. And he actually talks about the relaxation response, and you can actually go on YouTube, which is, once again, a technology, but he speaks about this. And what's interesting is the same room at Harvard where in the 60s, when the fight or flight response was identified, now the relaxation response is identified. Okay, so we're literally seeing that, okay, yes, we can get into fight or flight mode, but relaxation can heal. So we've separated the mind and body, and we need to bring it back. So yoga and our breath, we need to turn on our relaxation response. The dramatic effect is that in the body, our heart rate slows. Respiration decreases. Our blood pressure decreases, and then our body can heal. Our immune system grows stronger and stronger every day. Studies are showing over and over again, when we are fast-paced, we are making ourselves sick. I love this quote, "I will let my body flow like water over the gentle cushions." Water is healing. And I would love for you to consider doing this before you wake up in the morning, to be mindful before you move, okay? To actually just take a couple deep breaths, breathe behind your eyes, breathe in your belly, and then breathe to your toes. I am a big fan of eye pillows. And I use them before I go to bed at night, and I'm mindful of my breathing beforehand. And I just want to say that I see the sweetest person in here. She made the eye pillows at the wellness community. And I have not seen you in so long, and here she is. Thank you so much for being here. She made eye pillows for the cancer support community, and I teach kids and adults, and I carry her eye pillows that she made specifically for me all around the country. So namaste, and thank you. What a special treat to see you here. Taking our eyes, I had you take your glasses off, putting an eye pillow on takes the muscles, we have so many muscles in our eyes. It takes thinking out of it. It relaxes our brains, and by relaxing, we heal. I give eye pillows to all my kids' teachers, and I give eye pillows to anybody and everybody that will use them. You can even take an eye pillow at work and put it on your eyes for a couple minutes, put it back in your drawer. It's a wonderful healing tool. I love this quote, minute by minute, thought by thought, your mind is what shapes your life. You know, thinking about healing yourself really is about the breath in particular. And that actually helps to inspire our minds. I'm going to talk about that right now. We talked about, Dr. Swan talked about chemo brain. I have a solution for some chemo brain thoughts, okay? One is walk backwards. I walk backwards around the reservoir in Lafayette. I don't do it the whole way, and all the people that have been in my yoga classes have heard me tell this story many times. I don't do it all the way. I actually run for most of it, and then the last quarter mile, maybe, I walk backwards. Now, here's what's great about it. First of all, there's a line at the reservoir that you can use your peripheral vision, so you're not going to totally fall over. The other thing is that you're retraining your brain to learn a different skill, just like you would if you're learning a language. Your body is learning a new language. You have to focus as you walk backwards. I do my best thinking when I walk backwards. Here's why. When you see the trees at the reservoir and you're walking away from them, you think about where you've come from, not where you're going. We are too many times thinking about what we need to achieve. How fast do we need to do it? What about what we've accomplished? It's amazing what we've accomplished. Let's think about that. We're walking away from what we've accomplished. The last thing I'd like to say is walking backwards uses the muscles in the back part of your body. And just like an elliptical machine would be in a gym, you're using the muscles in the backs of your legs, not your quadricep muscles in the front. Okay? The other thing I just learned about this week, and if you do take nothing from this, the breathing, but the super brain yoga. So there, if you go on YouTube, it can tell you how to do this, and it literally takes 2 seconds, well, three or 4 seconds. So I'd like, if you can you stand up in your, you can put your tennis ball on your seat if it will stay there. Doctors, I'm going to be without the microphone for a minute. Doctors, occupational therapists, teachers are all using this, and they're actually seeing dramatic results. Take your left hand and reach, I call them pinchers with kindergarten students that I work with. Take your pinchers and hold onto your earlobe on the right. We're going to balance our brain. Take another deep breath and take your pinchers and have your thumb on top and take your right arm and have it be on your left earlobe. What you're doing here is that you are balancing both sides of your brain. You're balancing your pituitary and your pineal glands, which are hormones in our brain. Take a deep breath in, and then exhale, bend your knees, and then exhale and come back up. And we're going to do this 15 times. Good. Inhale and down. Exhale, back up. Inhale and down, 2. Exhale, back up, 3. Inhale, 4. 5. 6. 7. 8. 9. 10. 11. 12. 13. 14. And 15. And now give yourself a hug. And you can have a seat. Those are acupuncture points on your earlobes that you stimulated. And what they do is balance. The other point that I want to make is it's so easy to do. And the gentleman that came up with it, his name is, I wrote it down for myself to remember, Master Choa Koksui. So you can look on YouTube and you can they go through how to do this. Eye exercises are another thing that I talk a lot about. We can certainly relax our eyes, but our eyes actually stimulate parts of our brain. So, and our ocular nerve in particular. So you can take your eyes and follow, keeping your head straight and still. Take your eyes up, to the right, to the left, and down. Right, left, back, and down. You can do that a couple times a day, and it really does help. Finally, alternate nostril breathing. Now, I'm going to tell you something that is going to sound a little nutty to you. In fact, probably a lot of the things that I do are nutty. But there is an Indian thought with yoga that literally when you breathe in through your left nostril in and out, it's calming. And when you breathe out of your right, it's energizing. So, for instance, I work with a woman right now that has schizophrenia and bipolar disorder. And so when she has manic days, I encourage her just to breathe out into the left nostril. When she has days where she's calm, she does the right when she needs to be energized. So alternate nostril breathing balances our brain. So if you take your thumb and you cover your right nostril, inhale through your left. Take your index and middle finger and cover your left and breathe out through your right. Inhale through your right, and then exhale through your left. And the idea is that doing that 10 to 15 times will actually balance your brain. Now, here's where the tennis ball comes in. How many of you sit like this? Who falls victim to that, especially with your computer? So what doesn't work is that our bodies were not meant to sit like this. In fact, there's a woman in Palo Alto who lectures, in particular I saw her lecture with Google executives, and she basically says, she's looked at posture around the world, and we as a Western culture have created our postures. We start with our children in umbrella strollers. We created that. We're starting with our tail tucked, and our posture becomes like this. So what I'd like for us to do is feel a difference in what that feels like to do something about it. So take your tennis ball, and depending on your height, this is the tricky part. I wasn't sure about what these chairs were going to be like, but if you can take the tennis ball and put it between your shoulder blades in your back. And if not, just do it as high as you possibly can. So as you take a deep breath in, see if you can have both feet flat on the floor. But hug your shoulder blades in and down behind you with that tennis ball hopefully helping to support you. Take a deep breath into your breastbone. Good, and exhale to your tailbone. Inhale, take your ear to your right ear to your right shoulder. Exhale, come back to center. Inhale, take your left ear to your left shoulder and come back to center. And finally, as you inhale, see if you can take your right hand on your belly and your left hand at your low back so that the back of your hand is facing your low back. And as you inhale, you're going to lift your chin and your chest slightly. And exhale, bring your belly button in and down. Inhale, fill your rib cage with air. Exhale, bring your belly button in towards your spine. And release. I actually take a tennis ball in my car, and I have it at my shoulder. Now, it can't roll around, obviously. I take my tennis ball on planes, and I put it in a pantyhose and tie it to my chair. Oh. And I can roll the tennis ball on my feet and open up every acupuncture point imaginable to balance my body. I take my tennis ball in the hotel room, and I work on my shoulder and my spine. So in yoga, we feel the support, the energy of community support. And what I love about this, first of all, they have very tall spines. Isn't that nice? The other thing is that we have the energy that we have, someone takes on. So if we're having a good day, there's no surprise that people around you are going to have a good day. And if you're around people that do not have good energy, it will come back. So what I try to do is in our mind's eye, send thoughts to this person. We're going to work together, and it's going to be good. Okay? And that support, that community, has gotten all of you probably through many things, and I know the cancer support community is a wonderful place for that support. Finally, let's light our candles for health. Let's think about changing the way we think, the way we move, and I end my class at the Cancer Support Community by lighting a candle. And when we leave, at the end, I give some thoughts. And here's what I'd like to share with you. Let's consider that our candles are lit. We're taking a deep breath in. We're sending our breath into the world for change.